it's Sarah with registerednursern.com, and in this video I'm going to go over 6 tips for pre-nursing students. So this video is for people who are going to be going to nursing school, but right now their major is pre-nursing. You're taking the pre-requisite classes before you actually even apply to nursing school. But you may be wondering, what can I be doing right now while I'm taking my pre-requisite courses whenever I'm planning to go to nursing school? So I'm going to give you 6 tips on some things that you can do to help prepare and hopefully increase your chances of getting into the program. Okay, tip number 1. Develop study habits now. This is so important. Your pre-requisite classes before you actually start your nursing school classes are the training ground to figuring out what type of learner you are. Are you a visual learner, an auditory learner? Are you a combination? Do you work best with creating flashcards? This is where you can work on honing on your note-taking skills, how to develop some study strategies, because when you hit your nursing school classes, you already need to know how to do that. So really buckle down, try hard, and figure out what works best for you in your classes. Tip number 2, keep your GPA up. I recommend that you go to your College of Nursing's website and see what the GPA requirements are. Either keep it at that GPA or, of course, above that. You want to study hard and pick good professors. Having a good professor can make or break your time in an anatomy and physiology class, a microbiology class, or anything like that. I remember whenever I was in nursing school, I was a pre-nursing student, we had several professors we could pick to take anatomy and physiology. And there were 3 professors. 2 of them, they had great ratings. The other professor had horrible ratings. And some students didn't listen to those ratings, and they took the professor, and I talked with them, they're like, yeah, that class was really bad. And they were either having to retake it or they got a C, while I had a great teacher, got an A, and everything worked out good. And I recommend to learn a teacher's rating that you go to ratemyprofessor.com, and you can search by your school, your professor's name that you were maybe going to take, and see what other students are saying. That can really help. And of course, ask other students who have taken the class before you. Next, keep your grades really high in those prerequisite courses that the nursing school requires you to take. The nursing school I went to required us to take, their prerequisite requirements were anatomy and physiology and microbiology. They said we could score no less than a C in it. And I have seen that some nursing schools who are competitive, they will vet students and accept them based on how well they scored in that class. So say that year you're going to apply, the competition's really high, and you're with a lot of other students who are applying, they may only accept the students who got an A in anatomy and physiology. So try to keep those classes, concentrate on those classes, and keep those grades high. Next, figure out the GPA requirements, which is what we just went over, and retake any class or any extra classes that you may have failed that's hurting your GPA, because you want a great GPA. So either retake that course that you didn't do too good in, or maybe take some easier classes to help hopefully elevate that GPA up. Okay, tip number 3. Be sure that you're taking the correct pre-requisite courses. I cannot stress this enough. This seems like a simple thing because, you know, you're going to look at your College of Nursing website or their handout book to see what classes you have to take. And to do this, you want to make sure that you also meet with your advisor regularly, because I have heard of some students saying, well, they said I had to take 2 social sciences, or I had to take a psychology or a sociology, so I took both. And in reality, they were probably supposed to take something else, and whenever they applied to the nursing program told them, oh, you're missing one of the prerequisite courses. At this time, we can't accept you. So they're behind a whole semester because they took the wrong class. So always make sure you're meeting with your advisor regularly and taking those correct classes. Tip number 4, start prepping for entrance exams. A lot of times before you are actually admitted into the program, the nursing school program, they will make their students take what's called an entrance exam. So what you need to do is you need to first see what type of entrance exam they require, if any, and if it's required for admission. And if it is required for admission, what do you have to score? So those 3 things are very important. Then if you do have to take one, it is required for admission, then you'll want to get the study guide that goes along with the exam that they require. For instance, a lot of nursing schools require the HESI A2, so you'll want to buy the HESI A2 study guide, or the TEAS, buy the TEAS study guide. So always make sure you're looking at that and you're prepping months in advance. You don't want to be prepping the week before, 2 weeks before. You want to make sure that you're prepping months in advance, and you can start doing that while you're a pre-nursing student. Tip number 5. Prep for your nursing school interview. Some nursing schools don't require an interview, but some do. I have a whole video on common nursing school interview questions. A link should pop up, and check in the description below for a link to that video, and look at the common nursing school questions you may be asked. You want to make sure you dress appropriately for that, and that you go in ready, prepared to answer those questions. And last but not least, tip number 6, consider getting a job in healthcare, either part-time or on a PRN, which is an as-needed basis. If any time during your college career when you're able to work, this is the time as a pre-nursing student, because you're not having to go to clinicals, do projects, have a lot on you. So you can actually have a job. But what you want to do is possibly get a job either working as a certified nursing assistant, a clerical, anything available that interests you in the healthcare setting. I really recommend a nursing assistant since you are going to become a nurse, because you can build on that foundation of what a nurse does. You'll be working beside one, see what they do daily. It will help you with networking. Say your dream is to be a labor and delivery nurse. Hopefully you can get a job working as a CNA in a labor and delivery unit, and you can know nurses there, and hopefully once you become a registered nurse, they'll have a position for you and you can have it because you've worked your way there, they know you, and they'll give you the position, and compared to other people who would probably have a harder time getting that position since you already had your foot in the door. It's extra money, never a bad thing to have extra money as a college student, and it builds on your resume, because a lot of times people don't have any healthcare job experience whenever they're entering into the registered nurse field. So that'll just look good and show your employer that, hey, you have some job experience. So that was 6 tips for pre-nursing students. Thank you so much for watching this video, and please subscribe to my YouTube channel.